Watch this congested nose clear in seconds. Stay with me, I'll show every step. Quick safety: wash hands, hair back, tools wiped with 70% isopropyl. Start on dry skin, don't extract cysts, see a dermatologist. We begin with the foundation of an effective routine: a proper double cleanse. First, the oil melt. On a dry face with dry hands, apply a light cleansing oil. Oil attracts oil so it effortlessly dissolves makeup, sunscreen and sebum without stripping your skin's moisture barrier. For 30 seconds, use your fingertips to gently massage in slow, circular motions. Focus on congested areas like the T-zone and chin. Now, add a little lukewarm water to emulsify the oil. You'll see it transform into a milky texture. This is a vital step that lifts dissolved impurities from your pores, ensuring a clean rinse without any greasy residue. For the second step, a water-based cleanser. A gentle amino or gel formula is perfect for removing any remaining oil and water-based debris like sweat and dirt. Lather a small amount and cleanse for 40 seconds. This allows the ingredients to purify the skin without causing dryness. Always rinse with lukewarm water. Hot water can cause inflammation. Now, the dry down. A common mistake is rubbing your face. Instead, gently pat your skin dry with a clean, soft cloth to prevent irritation. Your skin is now perfectly cleansed, balanced, and prepared, a pristine canvas ready to absorb the powerful treatments that follow. Prime the pores: soak a thin cotton pad with 0.51% salicylic solution. Press onto the T-zone for 30-40 seconds, then lift, do not rub. This softens sebum plugs for painless release. Warm towel compress or short micro-steam for 60 seconds. Keep it warm, not hot. This loosens deep congestion without flushing skin. The loop angle is the secret. Watch the motion closely. Before you even touch the tool to your skin, proper preparation is paramount. First, ensure your extractor is impeccably clean. Submerge it in rubbing alcohol for at least a minute, then let it air dry completely. This is non-negotiable to prevent introducing bacteria into the open pore. Next, prepare your skin. The goal is to soften the sebum plug, making extraction easier. The most effective way is by working after a warm shower, or by applying a warm, damp washcloth to the area for several minutes. Now, for the technique itself, we recommend a small, thin-looped extractor for precision. Hold it like a pencil for maximum control and set the loop at a 30 to 45 degree angle to the skin. This angle is critical. It helps to lift the contents out, rather than pushing them deeper. Press the loop lightly against one side of the pore, then begin a slow, deliberate rocking motion from side to side. Never push straight down, as this can bruise the skin or rupture the follicle wall underneath. This gentle, wiggling action coaxes the compacted plug to loosen and lift. As you feel the plug start to exit, feather your pressure, lightening up to allow it to release without force. A crucial rule is the 2-attempt maximum. If the blackhead doesn't release after 2 gentle tries, stop. Forcing it will only lead to inflammation and potential scarring. It's far better to leave it and try again another day. Once successfully extracted, immediately wipe away the material with a clean tissue and cleanse the area with a gentle, alcohol-free toner or antiseptic. This helps to clean the empty pore and reduce any redness. For whiteheads, wrap fingertips in tissue. Press down and apart, then roll up to lift the cap. 2 soft attempts only. No nails, no digging. Reset, swap tissues, wipe the area with antiseptic or salicylic toner, and re-sterilize the tool. Fresh surface equals safer extraction. Calm the pore. Apply a thin layer of 0.51% salicylic acid to cleared zones. If skin flushes easily, use 10% azelaic acid or a PHA instead. Pat lightly, don't rub. If a bump is inflamed, ice wrap 60 seconds on, 60 seconds off, repeat 3 times. Then apply a rice grain of 2.5% benzoyl peroxide as a spot. Overnight, hydrocolloid patch on clean, dry skin. Let's begin the AM routine designed to protect your skin. I start with a gentle, hydrating gel cleanser. In the morning, we're simply washing away overnight products without stripping the skin's moisture barrier. I massage it into damp, lukewarm skin for 45 seconds to effectively dissolve impurities. Next, for active breakouts, I use a 2.5% benzoyl peroxide spot treatment. Lower concentrations are just as effective, but with far less irritation. I apply a microdose, a tiny amount, directly onto the pimple. This treats inflammation locally without drying out the surrounding healthy skin. Hydration is next. I use a lightweight, non-comedogenic gel moisturizer. Non-comedogenic means it won't clog your pores, which is essential for breakout-prone skin. Gel formulas absorb quickly, creating a smooth, non-greasy canvas for the final, most important step, and that is sunscreen. I use a broad-spectrum SPF 50. To ensure proper coverage, I follow the two-finger rule, a line of product on your index and middle fingers for your face and neck. This step is non-negotiable, as actives can increase sun sensitivity. Remember to reapply every 2 hours when outdoors. For the PM routine, we focus on cleansing and repair. On days with makeup or sunscreen, I double cleanse. First, an oil-based cleansing balm on dry skin. Massage for 30 seconds to melt everything away, then emulsify with water and rinse. For the second step, I use my gentle gel cleanser for 45 seconds to ensure my skin is perfectly clean and prepped. After cleansing, I alternate my active ingredients to prevent irritation. On one night, I use a salicylic acid serum on my T-zone to clear out congested pores. On the alternate night, I use a pea-sized amount of a retinoid for my entire face to improve texture and cell turnover. It is crucial to never use these two actives on the same night, as it can damage your skin barrier. I always finish by sealing everything in with a nourishing ceramide moisturizer. This final layer hydrates, soothes, and supports your skin's recovery overnight. Pro trick: mist glycerin or rice essence. First, then apply a thin clay mask only on congested areas for 3-5 minutes. The mist prevents overdrying while clay pulls oil. Melt, prime, lift, calm, maintain. That's the cycle for clearing pores and preventing rebound. Watch these results. Try this tonight. Save the video, subscribe, and check the description for product links. Educational only. For cystic acne, consult a dermatologist.